Thank you. Oh, everybody's got to turn off all of their. Sorry, just making sure we don't have feedback. So we'll call the meeting of the Fenwick Public Schools of December 8th to order, and we'll start with the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. So per Governor Baker's order suspending certain provisions of the open meeting law, the public cannot physically access the school committee meeting, but the meeting can be viewed live on channel 14 and also through the web link provided on our agenda. Most of us are here in person, but we do have a member zooming in. And if we can start, I didn't ask anybody ahead of time. Does anyone have the agenda open to read our mission statement?
I can do it.
That'd be great. Thanks, Melissa.
Falmouth Public Schools mission. The Falmouth Public Schools creates a world-class student learning experiences. Our Clippers are empowered to pursue their goals with curiosity, integrity, and resiliency. Falmouth Public Schools vision. Clippers are creative, inquisitive, and engaged learners who participate in their community as socially responsible citizens. Clippers effectively communicate and solve problems that impact the world around them.
Thank you. Do we have anyone who's making an audio or video recording of the meeting other than us? And see if I can get the list. If you can raise your hand if you're making a recording. Okay, great. So first we'll start with public comment. Please limit comments to 2 minutes per individual to items not on the meeting agenda. And there's no debate or action taken on public comment. Do we have any public comment tonight?
Awesome. Make sure people remember to raise it.
Oh yes, you can raise your hand if you'd like to make a comment. Okay, I don't see any. And also a reminder, you can always email the school committee if you would like to mention something to us. So we're going to start as usual with our COVID update. It's been a busy week.
It has. So we have Scott McGinn and Dr. Greg Parkinson with us. And I think they're going to start with their updates, and then I can give a little bit about what's happening in the schools.
Great. Scott, I see you're already up there. Do you want to start us off?
Yes, it has been a very busy week or so. So I'm going to share screen like as usual. Okay. Oh, can I have it enable the screen share?
Oh, yeah. Can we give Scott permission to share his screen? There we go.
Okay. All right. So we haven't had a good couple weeks. So if you look at the chart, you know, it was nice when we were talking early in the summer into the fall where we had less than 10 a week. You can see where we've jumped, you know, in just prior to Thanksgiving to, you know, 15, 18 a week. Then we jumped up to 30. And then in last week, we've had a couple of long-term care facilities have a lot of cases, which is, I think now somewhere up around 40 total cases. But if you look, the brown dot is what we've got so far this week. We're coming out of Thanksgiving and we're paying the price for, you know, the small gatherings that might have had people that were infected. And it shows in the data. If you look at the upper right hand on 12/4, we were at 436, 12/7, 465. And in a day, we've gone up to 488, which has been 59 cases roughly since around the first. You know, a percentage of that is long-term care, but a lot of it is community spread happening mainly from smaller gatherings is what we're seeing, is where most of them are coming from. There was a real big, and I'll show you in a minute, in Barnstable if you haven't heard, and that's come from church events and things of that nature. And some of that may have worked its way here as well. So, you know, I wish I had better news. It's nice when I have, you know, I'm in and out here in 5 minutes with 4 cases. We're not at that point right now. We're at a different point. I think we're, you know, in the sort of the dark times of the virus. So if you look at the next chart, you can see that, this is where when the line is flat, that's where we're in good shape. You can see that we're not even close to being flat. We're actually at where we were, let's say, the first month of it. So in that regards, that we've had an increase, no doubt, as have everybody. Again, the yellow-green chart is always something that we look at. We were yellow, and I'll show you in a second, 43 or more cases over 2 weeks based on our population, or a 5% positivity rate. Red would be both 5% greater, 5% positivity and greater than 43 cases. Looking at this is a little old. Now you got to remember that when the state publishes this on Thursday, they're going for the 2 previous full weeks. At that point, we're at 421 with 78 cases with a 2.3% positivity. So we were yellow because we were less than 5, even though we had greater than 43 cases. The state and the county has been also on the high side. Now, anything over 2% is not good. Once you get over 2%, you start climbing relatively quickly. You'll see it in a further chart that the state has on positivity. We were doing really well at staying below 2%, but you can see where like 11, 19, you start creeping up, and we had a bad week. And again, some of it would be, some of it's the nursing facility, but not all of it, and not, maybe a third of it, and it's still a relatively high number. And so that's kind of where we're at. Now, if you look at the entire county, I feel really bad for Barnstable. In the same 14 days, they had 359 cases. And Yarmouth had 100. We didn't have a great week. So you see a lot of yellows, and you see a couple of reds, Edgartown and Barnstable. The county's positivity has actually crept a bit past the states. And there's been some super spreader events happening on Mid-Cape that's worked its way. And so it's, so there's definitely more cases. It's obviously making it a lot more difficult to do all the contact tracing and all the calls. So, it's taxing on everybody. One of the things that we're doing here at the town is, the VNA and the CTC have so much staff. So we're also looking at contact tracing. So contact tracing takes about 45 minutes per person. It's asking a lot of quality questions, symptoms, and so forth. The bare bones questions are, who's your contacts? Where do you work? Do you have kids in school? So I've made a sort of a quick scaled down version that if we see gaps in the contact tracing, just because people haven't returned, and I'll talk about that in a second. We're having trouble in this flare up. It's been harder to get a hold of people, and part of it's because it tends to be more younger people. I'll show you that also. And maybe they don't want to talk about who their contacts are or return our calls. So we're jumping in as well at the health department and really trying to get that data and trying to get that information as quick as we can. So we're ramping up and trying to fill the gap, sort of like putting our fingers in the dike, trying to stop the water as it comes in. That we're also really making calls and jumping on it even more so than we did, just because of the ability of the CTC and the VNA to really keep staying on the cases. And so, and it's been effective. And when we get information, we give, the long contact trace, I call it like a long contact, the 7-page form from the state is still done by the VNA and the CTC. I just want to get the information as quickly as possible. So that's one of the things that we've done. We really don't have the time to do it, but we're doing it anyway, type of thing. Looking at the county, it's been steady, 30 or 40 cases per day. It's kind of been, these are averages over 3 days. Statewide, these numbers are a bit low. The tests, for some reason, over the last few days have been in the 50s and 40,000s when they were close to 100,000. We're getting about 3,600. So if we had 100,000, we'd have been somewhere between that 5,000 and 6,000 where we've been. Deaths were 40 for the day. That's been relatively about what it's been. You can see on the right-hand column that most of the cases are more of the cases. And the reason why the hospitalizations, when we had that many cases in the spring, we would probably have about 200 or 300 hospitalizations, more a day, and then you'd have a higher death, but you're not necessarily, because you're doing a better job. You're still having the long-term care. We're having it here, blow-ups, but we're doing a better job with at least having less cases at that age group. Positivity, again, anything over 2 is no bueno. You can see where we're at 5.81 for the state. If you took out the testing that's occurring in higher education, we'd be up somewhere around 7, and that's a very high number. That needs to come down. We got to do something to come down. The governor just today scaled back to step 1 of phase 3, which puts more restrictions on certain businesses and gatherings and so forth. Hospitalizations haven't caught, luckily, are not at that same rate that we were seeing in the spring. Again, younger population, for most of the cases, we're catching so many more cases that we would never have caught early on. They are up. Some of the hospitals are starting to get into resetting up their COVID wards, so to speak. And I'll show you the cases on the next slide. So the next slide is from the county. If you the first 6 of them are early in the event, so April, May, you'd see high 46 and 13 between the 2 hospitals, between people in the hospital and ICU on that particular day. Then you see it drop to basically 2 to 0, and then they took a break in the data because they were 2 and 0, 2 and 0, 0, 0, and then you start to see it creeping back up. And so as of yesterday, and today is almost the same number, 5 in the hospital, 1 in the ICU at Falmouth Hospital. It's been like that for a week. Again, you're going to see a number like that because you do have a long-term care, and that tends to happen, unfortunately. And Cape Cod Hospital, I think, is 12 and 6 today. We remain the same. So the cases don't look good. The hospitalizations haven't luckily quite caught up, and hopefully won't. We're doing more aggressive, we're trying at the health department to take everybody that we have to really sort of dive down deeper and try to get to everybody that hasn't been, replying. The CTC will call and also text, but, we're getting too many people lost to follow up, which brings me to I'll bring my last slide up first and then go back. If someone is listening here, if we call, please respond to us. It's getting more difficult to get a hold of people. We need to be able to do that to get a hold of people. So that's been something that we've been working on. It's not bad, but we're still, we don't like it. The other thing that I've picked up on is if you got mild symptoms, I think people sometimes think it can't happen to them. I didn't do anything bad. I don't think it can happen to me. And they may go walking around with the sniffles or the sore throat or a little bit of congestion and not really think of it. And I've read a few that, somebody got tested 4, 5, 8 days after that sort of symptom started. Well, they're just walking around, shedding it all over the place, and we don't want to do that. Going back to some good news. So today, Dylan Fernandez, our rep, and Sue Moran, a senator, they got $300,000 from the state. So the Barnstable County Health and the Environment, the Barnstable County, and the MRC stands for the Medical Reserve Corps, are running a clinic at the Barnstable County Fairgrounds, not a clinic, sorry, a drive-through testing site. So you're going to come up off of, what's that road? Oh, geez, I'm having you come up down off of the road where you have the rides and so forth, the lower level.
151.
Courier Road is the road I wanted to thinking. So you would come into Courier Road, take that first right, go down that way, and it's in the big barn, the big maroon barn. And so I'm interested in it because when we get time to start doing, we have like an emergency. I've ever heard the term emergency dispensing site. Back around after 9/11, the state told all towns that they need to have an emergency dispensing site. And we chose, so if I had to give, prophylactics, a pill out to everybody in the town within 48 hours, I have to be able to do it. Well, our site right now is the high school. And obviously, if we're going to do a long-term vaccination site, the high school may not be the best place. So this might be the place. We've already, if you remember, we did a flu clinic. I did a flu clinic back in, I want to say October. That was at the Gus Canty. I can probably do around 4, maybe on a good day, 500 people per day. So this place, because we can do 3 lines inside the barn, might be some place that I would use that would be able to do a higher capacity. Don't know how I would be getting the vaccines in. So I don't know if I'm getting them in a trickle, probably be a trickle at the beginning and a tsunami later. So, that's something that we're working on. So as far as vaccine goes, over this week, we're supposed to, about 8 selected hospitals, not Cape Cod Healthcare, were chosen for staff to start getting their vaccine. Eventually, that's where it'll go to. It'll go to the hospitals first, the emergency room nurses and doctors and so forth. From there, it would go long-term care and first responders. And then eventually it would go to, high risk over 65 general population and work its way from there. So, we've been in discussions on how we do vaccine distribution. We have to be sort of flexible because I don't necessarily know, at what point and quantity wise, if I'm running a longer term, smaller clinic, or I'm running a larger, faster term. So, those things still need to be worked out. And so I'm seeing if I'm missing anything else. And so we have our drive-through up. So I think I've covered everything. So definitely the cases are up. I'll come back here because that's what I call the money slide. Tells you a lot of information right there. I colored that circle a Thanksgiving color because I think that had something to do with it. People moved and not everybody stayed home. And the events that we're finding tend to be smaller events, families getting it, that type of stuff, not necessarily, these, larger events and supercenter events. So, so that's what I have. I'm sure you guys have some questions.
Yeah, I'm guessing there's going to be questions. I'm going to start with Bill because he's at home. And Bill, do you have any question before I forget to call on you?
No, not right now, Scott.
Okay. I just don't want to forget you.
Yeah, I thank you for the update. I'll tell you, it's really great. You sent it out. We had it online today, so it gave me an opportunity to go through it and take a look at it and look at the increases. And I appreciate this, and I'm sure the community appreciates this because it gives us that opportunity to every 2 weeks to really take a good hard look at this. And I thank you for that. Right now, I have no questions. I think there's a lot of things floating around in my mind about the increases. But again, I'm looking at Thanksgiving. I'm more concerned now that we're looking at Christmas and we're looking at other holidays coming up. So those are very concerning. But again, thank you. I really appreciate your time.
Yeah, you're welcome. Now, I don't have a crystal ball. Again, I haven't really said this publicly, but I don't know the state's game plan. My guess is he's got to balance the business and the disease, right? So you got the viability of businesses and diseases. I wouldn't be surprised if we really start going a lot stricter after the holidays. All right. That might be something that we consider. At the selectmen's meeting last night, and I'll say it to the audience here, that pretty much everything's open, right? You can go to pretty much anywhere. One place you can't go, I've had season tickets for 27 years to the Patriots. I can't go, right? So there's certain things I can't do, but by and large, we're open. So I want people that are high risk to think about what they were doing in the spring and what changes they've made since the spring. Because essentially this summer, we didn't have the disease here. 5 or 6 cases out of 1,500 tests is basically pretty darn close to zero. But people, I think, need to start thinking in terms of your high risk and maybe thinking about modifying your behavior and not going to 9 stores because you're bored or something of that nature. Just start thinking about the things the precautions that you took earlier on. If you're high risk, maybe start thinking about stuff like that. So that's just something I thought popped in my mind. I figured I'd say it.
I think that's helpful. Terry, did you have something?
So obviously being on the school committee and dealing with school people, you think, what about our schools, staying open? And I think this week, so many bombs hit me. I mean, really bombs, like whenever Worcester was on national news because they have a field house and that's in our state. And the fact that we tests are taking so long now because the labs, I mean, it's great that we're opening up that place in Falmouth on Courier Road to help you with the name again. But the labs are getting backed up. And I know the DESE, encourages us to stay there. But I think in their formula that speedy testing is part of the thing that they think will help schools stay safe, and tracing. And I think about the results are getting backed up. And whenever you have kids in the Lawrence School, teachers moving around, and in the high school, students moving around. So tracing, I think, is getting more difficult because of like you said, you're having trouble with tracing everything. So I'm just wondering, do you think there's a point that we might consider going remote? Would you give a percentage number? Or, I mean, I just think that there's things that are not in our control as a school district that are hindering us.
Hi, Dr. Parkinson. Thanks for joining us.
Yeah, I just wanted to, before the sort of final comment on that, I just want to throw another piece of information in there for your consideration, because, and I think it matters. And we've talked about this as Cape-wide school physicians and nurses, and I'm not sure that the general public is aware of it. And I don't have hard numbers to back it up, but what we have seen up to this point is a much higher case rate in children who are virtual than ones who are at school. And you can we don't have the reasons exactly for that, but I think it's in part a testament to the job that the children are doing and the job that the teachers and the other people at schools are doing. And probably as well relates to the fact that at home, there's a certain feeling of maybe I'm safe because I'm not at school, or I need to have some socialization or what have you. And so I'm not saying that there's not a certain point at which the schools would have to close. And, I think Scott has more got his finger on the pulse of, the metric for that. But I just want people to understand that closing the schools does not necessarily reduce the burden of disease in the community. And in some ways, you could argue that it has the potential to increase the burden of disease in the community from what we're learning based on where the cases have come from up to this point.
Yeah, I was basically going to say the same thing. I think your cases will increase in the town as a result. And it's borne out of, you see it in the data with the state of Rhode Island. I think I've mentioned a couple of meetings ago, about 100,000 kids in person. There are roughly 50,000 kids remote. And at the time that was in about 7 or 8 weeks into school. So you're talking October-ish. It was double the amount of cases among half the amount of kids in the remote setting. So the cases are coming in from people, the cases are going to come in. They seem to come in less when it's in a controlled environment. There's no control once you're out in the general population per se, unless obviously if we all stayed home like we did in April and no one moved anywhere, then that would be, but that's not what we're doing right now. So, not everybody is treating it at the same rate. Different people are treating it differently, and you're going to end up actually having more cases, at least in the data, both in Massachusetts, even though I don't have a study, the governor has mentioned it, but definitely in Rhode Island with that 7-week study clearly shows that, that's a pretty good data, it's 7 weeks. And, if you want some of that data, I don't mind looking for it. If you want me to sort of come up with any decent studies on that.
No, just you've analyzed it, so that's good. And the other phrase that prompted me to ask you these questions was this community spread. I mean, we didn't have that to worry about in Falmouth till recently, right?
Yeah, I mean, I still look at that chart, that first chart, and you see all those low. I mean, I was very surprised with 60 to 80 plus thousand people here all summer long, even though we were only testing Falmouth residents. That's what would show up in that data that we would still see if it was spreading amongst travelers or visitors, it would be showing up in our caseload. It was essentially pretty darn close to zero for quite a while. And so, but yeah, now there's definitely community spread. It's usually, if you think about, okay, for example, let's take the 59 cases and let's take some nursing home. Let's make up a number of 40. Of those 40 cases, it might only be 22 families, right? Because you're going to have multiples within a family. So it's 22, so one becomes 2.5 based on, whatever the family structure is. So, and then there's one-offs. So, one could be 3 within a family, though that's one community obtained, right? So you obtained it once, and then it ended up being 2 or 3 cases. And that's kind of so 60 is an easy number to get from 10, because it only takes maybe 20, 25, virus transfers among strangers to get you to that number. Does that make sense?
Yes.
Okay.
Thank you.
Leah and then Andrea.
So this is actually a question for Scott and for Dr. Parkinson. we're going to go over our goals. And one of our goals as a school committee that we'll be sharing tonight is around supporting Lori in kind of COVID kind of transparency and openness, and also really supporting our school system to remain open and safe. And one critical way of doing this is stopping the community spread, right? So one of our ways to look at this is to build partnerships or collaborations with other organizations, other groups. And I was wondering if either of you have some ideas of organizations, people we could be reaching out to within the community, who we could share resources with, who we could really talk about just kind of movement around stopping the spread. So that's my first question. Then I have one other thing.
Yeah, I'll take that one. Well, it would be, in no particular order coming to mind, it would be, church organizations. It would be sports, karate, dance, things that your kids go to. You might want to reach out to the business owners there, right? Because, you guys might do a fabulous job keeping everybody's apart, but then, somebody from 3 kids from East Falmouth, 3 kids from T-Ticket, and 3 kids from North Falmouth all get together in a dance class and they're not having masks on because the owner's not. Now we get complaints and follow up. I mean, we follow up the same day, right? So, but, if I don't get a complaint, I don't know what I don't know. So it may be reaching out to all the different activities that the kids are in after, I'm trying to think of other types of things so any of the things that the kids are doing, as a normal thing, Cub Scouts, Girl Scouts, things of that nature would be, all the different type of extracurricular activities would be something I think off the top of my head.
That was really helpful.
Really, yeah. And then my other point, it's not really a question, but it's just the schools are such a kind of mecca of being able to communicate information out to a huge portion of our community. And so my thought around contact tracing and really cooperation with contact tracing, I was thinking maybe we could do something in the schools to just blast out some information around what contact tracing is, just a way to support you in the process and to support our families in understanding what that is.
Yeah.
So,
and what it isn't too.
And what it isn't, right?
Yeah.
But yeah, and kind of walking through, because it's hard when you have some random person calling you and wanting to know, and just understanding that there's no risk involved in it. The only risk is that if you don't cooperate with that, you're going to continue the spread, right? So how important it is to respond to those calls. And when you see a strange phone number come onto your phone, answer it, because it might be really critical information. So I was just thinking maybe there's some way that we could be spreading information through our school system. You have such a great mechanism with, is it School Messenger or? Connected, yeah, so the Connected way. So that's a thought, just trying to think about ways that we can support this.
Yeah, because last week I got a letter from the CT. It was a general that went to all health departments about their difficulties, and the VNA says it's, for some reason, it's a lot harder at this wave than it was the first wave to get compliance with answering the phones. And part of it is, people don't want to rat out their friends if they're young and healthy. I think, somebody who's, maybe a little bit older might be a little bit more, I can remember myself a long time ago in my 20s and may not be quite as compliant as I would be now. So.
Right, and we might have some of those 20-year-olds as parents in our system, or we might have, the grandparents of those, of the parents. Yeah.
Thanks. Andrea?
That's a perfect follow-on to what Leo was saying and about the contact tracing and that being a critical piece. And this might be a really obvious question, but when the VNA or the CTC contact tracers call, is that number identifiable as such? Or does it look like any other kind of spam number?
Well, the CTC one might, if you have caller ID, would probably show up. There's also a text that's sent. Hi, this is, Ariana from, the CTC looking to contact you. Please call this number. And text is, everybody's texting like crazy. So texting is really effective. The VNA would come up, it would come up as caller ID, but it would be a 375 number because they're out of, I think 375, they're out of Barnstable, Dennis area. So it'll be that number. And if it's us, it's the 495-7485. So, to elaborate what we're trying to do with the health department to help the VNA and the CTC is it's going to end up being 2 calls. Let the CTC do their long drawn out. I just want to get the information to Jen, your school nurse, as quickly as possible. I want to get the employer involved quickly as possible. So you could see that, you could see the health department, or you might see, so it's not, unfortunately everybody gets 5 spam calls a day and they might think of it as spam, but that's the reason why you do the text as well. And if I see lost to follow up, if the CTC hasn't been successful, I have, if you don't know, we've since COVID, the last few months, I've hired Kathy Gwynn, who's my nurse. And so Kathy spends pretty much her day her and I looking at Maven, which is the epidemiological site, looking for gaps, like hasn't called us back, right? And it's been 24, 48 hours, hasn't called. We're going to continue to call. So you're going to see multiple numbers come up. Eventually, hopefully they call, and we'll just keep calling.
I wonder if there'd be some value to having the enterprise or any other media outlet publish a little blurb with the numbers. If you get a call or a message from this number, please know that it's the health department or something along those lines.
Yeah, well, let me take that down.
If it comes up as health department or something like that, I think people might be more likely to do it. And even leaving voicemails, like those don't get checked anymore, right? So I don't want something that could have a simple answer be holding up the work that you guys need to do.
Yeah, and also, with the parents, the other thing you really want to do too is with the parents, when you send out a message, is that, Maven, for example, let's take Dr. Parkinson's office. So if he does a test and he's using an antigen, his office is going to be responsible for entering that into Maven. Maven's then going to create a case, which is going to send it to the VNA. Well, that takes time, right? It might be a half a day. It might be several hours. It could be. But the parent would be also contacted immediately. So the parents, it's also the onus is on the parents to make the immediate call, because sometimes it's going to happen before. So for today, we went from 465 to 488. That's a boatload of calls, right? And that's a boatload of work. Trust me, I'm still here at work. So it's a boatload of stuff. And so, sometimes the call doesn't come as quickly. So a half day makes a difference, right? You had school open and somebody's there. So it's also the onus is on the parents to also call the school, because the process does take time, right? It's going to go so I don't know how a pediatrician's office would do it. And, but you're going to get a call, because that doesn't go to a lab with these rapid antigen tests. So they'll be uploaded from the office directly into Maven, and that has to happen quick. And so if the parent finds out at noon, but it doesn't get into Maven till 5, and then I'm contact tracing it at 8, there's a delay there, right? So there's a whole school day there. So it's also the parents need to also take responsibility as well.
Thank you. Anybody have any other questions for Scott or Dr. Johnson? Thank you so much, as usual, for the information. Did you want to share anything before we let them know?
Yes, I do. Dr. Parkinson may have something else, because I don't know if he was responding or if that's what he wanted to share tonight.
Dr. Parkinson, did you have anything else that you wanted to share with us?
I think a couple of things, actually. First of all, it's great to have Scott's data, because it's just so helpful to confirm, I'm on the other end of the caregiving spectrum where we're seeing the people come in, and certainly the canary in the coal mine suggests that the same trends that Scott's seeing, and where we were seeing an occasional positive here or there, we're seeing them much more regularly in the last week. And so, that's for everyone to be aware of. The second thing is that, the whole concept of COVID fatigue, and, we all understand what that is. And, I've had several, shall we say, direct conversations with people that kind of say, I'm done with it. And unfortunately, it doesn't matter whether we're done with it. And, some of this is by proxy. And so you have somebody who gets infected, who's young and healthy, and then they, then there's somebody who has a contact who has to close their business because they were a contact, or an older person. And I think this really is where an opportunity where the community needs to come together and think about how it's affecting everybody else and not just their own immediate circle. And if that's not enough to convince you, then I would tell this story of a family who had somebody, a young child, test positive, and then, so that's 10 days at home, but it's a young child, so the parent has to be involved in the care of that child. So then there's a quarantine period after that. And then if the parent gets infected at the end of that quarantine period, that's another 10 days, plus another quarantine period when it, for the second person that's infected. So once it gets into your home, it's a disaster in terms of, if you want to wipe out your entire holiday season between now and January, a good way to do it is to have COVID come into your house. And so even if you're not worried about the seriousness of the illness, which is, of course, for some people it is, in terms of the impact on your personal life, if you are restricted to home for weeks at a time, that I wonder if that's something that people might take to heart.
I appreciate that. Thank you. And it's helpful to hear the whole COVID fatigue thing stated out loud, because I think that's where we're at. People are tired, and I think we've forgotten how careful we were in the spring that got us through the summer. And unfortunately, that's coming on the heels with lots of exposures and lots of cases, and lots of parents having to answer that call and find out that their kid was exposed because we're being super cautious. And the combination is it's hitting very close to home for a lot of people.
Just one extra thing to add on to that. There was a medical historian on the radio last week talking about the last flu epidemic and also the cholera epidemic in the 1800s, and the tendency of communities to think it won't happen in our community, that somehow, for whatever reason you pick, that we are going to be, for lack of a better word, immune to it, or at least spared by it. And the fact that it's in our community more now than it was in March, it really does change the game. And we can't just say, well, it happened in March and we got through it and then we were fine. It is, the ante has been upped on the Cape. It's starting to be now compared to what happened in the spring.
Yeah, and if I could add to that, it's also under, you can knock it down if you get religion again on it, right? So you can, we know what works. It worked, right? So we know that what we did in the spring worked. It worked really quick and really well. But it gets to the point where we need to take our own action, our actions seriously, and start to do the things that we were doing before in order to knock it down. And you can get away with a lot in July and August because we didn't have it here. You can't get away with what you could get away with before. So again, try to get into the mentality of what we were doing in the spring and the activity, because whatever what all 32,000 people were doing in the spring worked, right? It crashed. So start thinking about that, modify behavior. It's in, and getting back to there's been people in, that have been out of service for 30 days plus because of the family rocking through. Your 14-day quarantine or whatever doesn't start until the other person's out of isolation. Is a very long time. So I'm glad you brought that up.
So I just want to clarify one thing that you just said, Scott. So, and I think we heard both of you say that if we could get back to the behaviors that we had in the spring, we would really see a decrease and we'd be able to see the community spread end. But the big difference is that we weren't in school in the spring. But I think that the message I had earlier was that you guys both believe there to be, that the schools are actually not spreading, and that keeping kids in school is probably helping keep community spread at bay. I just want
is.
to make sure that I understood both of those things are simultaneous, right?
That would be my opinion. Yes. And you may not have thought of that earlier on, closing schools and because you're not just going to keep everybody home. I mean, again, if we never left our basements for the next 6 months, the cases will go to zero. But then again, you got to, like I'm not going to argue that point with you not moving from your house, but I'm just saying, just modifying the behaviors, even a little bit makes a big difference.
Right.
But
I got you. I just want to make sure that.
Yeah, but schools are not showing. It's not showing as like the super spreader events that you may have thought of earlier.
Right. Fair enough. Thank you. Did you want them to stick around?
Yeah.
Can you guys stick around for a minute until after Dr. Dorr?
I'm basically living here anyway. So
I know you said you're still at work, but I've never seen you anywhere else. So I'm not sure what you meant. I think you must have a bed in the corner.
Thank you. They may have more questions for you guys when I finish. So I just, we've had 21 positive cases, staff and students, since September 1. So I just wanted to kind of put it in perspective. Up until Thanksgiving, we hadn't had any positive cases in our schools. We had positive cases, but they were outside the schools. They were remote, or they were on their hybrid week, or they had just been out of school for some days. So when we came back on November 30th, after there were 2 cases that preceded, we didn't have the test results. That goes back to how long those test results happened. So they preceded the week that we were for Thanksgiving. But if we just say that's when we found out, we started our contact tracing. So on Monday, the 30th was our first time we had to do contact tracing. And so we've had 7 positive cases where they've been in the schools where we've had to do contact tracing. And that's among all staff and students. So, over 3,000 students, 660 employees. We've had only 7 positive cases where we've had to do contact tracing. Now, I mean, I get once you start doing contact tracing, then, we have a lot more students and staff that we're sending, home for those quarantine periods, right? But that's what keeps us safe. Those are our rules, I think, on that. So, and right now we have 5. And that's, because the 2 of them had come out of quarantine, and we now have 5 that's in quarantine, plus all those exposures are still in quarantine. And I know that to your point, Dr. Parkinson, that you had just shared, it can be frustrating, right? Because your kids are sent home, they're only in school X amount of days, and this happens, but this is what's going to keep us safe around. And I appreciate both of you, sharing that message, that is going to keep us all safe, and so that we don't have spread within the schools. But I know that the rules are kind of also confusing, and I just wanted to, we followed DESE's rules, and they had just changed those a couple weeks ago, where the 14-day quarantine for exposure got reduced, that if you were tested on day 8 and it's negative, you could come back on day 11. So after 10 days of quarantine. The CDC just changed theirs. I get a lot of questions about that. So the CDC just, they have now reduced their quarantine time, but we have not picked up on that yet. So, but it could, right? So I'm sure it's being reviewed, and it's possible that we would pick up on the CDC. But I also know that, that we hear from parents where different physicians may be recommending getting tested on different days. And so I don't know if you want to respond to that or not, because not everybody follows the exact same rules and timelines. And it does have to make a difference whether it's symptoms or, and then if it's exposed within the household, household members are getting tested faster, right, than waiting that 8th day, which I understand that, but it does get confusing for some of our families on this. And so I don't know if either one would like to respond to the different rules or can explain it, better. All I know is our rules and what we have to accept, right? And that's what we follow.
Do either of you have thoughts?
Well, I wish I had a nickel for every time the guidance was updated. Yeah, I mean, it changes. I mean, the science is, you know, after about 5 days minimum, you'd want to do a test, but that doesn't get you out of quarantine. You have to follow the newest guidance. You know, when I get new guidance, I send it over to Jen and Lori, and Desi should be either adopting that or not adopting that. You know, I leave it up to you guys to determine whether Desi's going to allow the new guidance. You know, what parents happen to you, Lori, were you commenting that some parents want to get a test and have the kid come back to school after lesser days? Is that what you're hearing, or?
Well, yes, some do, right?
Well, no, I mean, it's pretty black and white. It's just follow that guidance, you know, and we shouldn't be varying from that. If anything, that's considered a close contact. The hard part to me sometimes is determining the close contact. You know, I just had a conversation with a business that was like, well, it was 5 minutes here and it really wasn't, or was it? And then determining what the close contact. And when I start getting in down that wormhole, I'm just like, treat it like a close contact, right? So sometimes that gets difficult. It was determining what the close, but you guys are really good at figuring, you know, you're actually over quarantine. Sometimes you do have very aggressive quarantine, and that's the reason why you've kept it manageable. That makes sense.
Thank you. So I guess the other question is the day in which they should get tested, right? So we always said before this new guidance came out, you know, day 4 or 5 was your, you know, the best time.
Well, okay. So formal quarantine was, you can't test yourself out of quarantine all the way up until very recently. Then it changed to 8 days. You can get out by day 10 if you test no earlier than day 8. But there's some recent guidance. I've got it saved on my computer that is coming out. That just came out yesterday, but I don't have it memorized yet. So I've got it on my computer. Let me see if I can slide it out here. But that's an ever changing thing. Well, not ever changing. That hasn't changed. Let's see. Here we go. Hold on one second. So the newest guidance just came out to be, for example, 7 days of quarantine, release on day 8 if a PCR is taken on day 5. So we've always used day 5 as the minimum, and the state guidance is changing. And then so the day 8 get out by 10 was for about a month, right? About 3 weeks or so. And now the guidance just came out. Now, whether Desi wants you to follow that or not is a question you have with Desi. And then day 10, you can release day 11 if there's been no symptoms, and you do active monitoring through day 14. No test is necessary. So you can get out earlier, but this is brand new. Like, I just got this in from the state, like, I don't know, late yesterday afternoon. So you've got, you know, the rules do change somewhat. But what you can't do is be exposed and the next day run down and get a test, and when it's negative think you can come back. That's a no-no. It doesn't, like, you sniff it in and then you blow it out to the next person. It doesn't spread like that. So it has to incubate inside of you in order to grow, to show, and shed. So, you know, I think, you know, whatever the guidance happens to be, the newest guidance, that's the guidance you should be following.
No, I appreciate it. No,
Is that a long-winded way of trying to answer your question?
No, it was
you
helpful.
did. That was very helpful.
I'm sorry.
But then I ended up with a question for Dr. Parkinson, which is, you know, are you still here, Dr. Parkinson? Yeah, there you are. Yes. You know, you're not following DESI guidance. You're following different guidance, either from, I don't know, AAP or CDC or whoever. So is there discrepancy between the two that is, you know, maybe creating the problem, because you're following medical guidance from someone and we're following the Department of Ed?
You know, let's put it this way. The more consistent everybody is, the easier it is for people to understand what to do, and probably the more likely that they're going to do something that's approaching the right thing. So I think that there's always going to be different recommendations. I think I would see this one as somewhat glass half full. The necessity that COVID has brought has certainly led to more cooperation across Cape school districts on the medical side than I've seen at any point in my time on the Cape. And so I think, you know, we meet every couple of weeks trying to get on the page of, okay, how many days are you saying for this? Are you following the new CDC guidelines yet? Are you excluding siblings? And not everything is the same. And I think we just continue to work on trying to get that as close to similar as we can, recognizing that each district has its own final say.
Fair enough. Thanks. I think we cut you off. Did you have anything else?
Well, I wanted to give an update on the sports before, and this certainly kind of plays into, we had over 170 of our students participate in cross country, field hockey, soccer, and golf. The students really enjoyed themselves, and we had very strict guidelines, followed the MIAA rules, and we did not have one COVID situation come from any of our sports. So they were played safely. I'm really glad we moved forward and we gave that, an opportunity. So now we're into the next next season, and we have decided, Dr. Parkinson, along with Kathleen Burke and Mary Gans, Tim Wakefield, we talked through it. We've got, MIA guidance. And so we are moving forward with modified basketball and modified ice hockey. So we're moving forward with that. Starting next week, they'll start with tryouts and practices. But we have agreed that we're not starting any games until January. So, but they can start on the practice. And the coaches are excited. Everyone has done such a great job with following the rules that I hope this opportunity also gives our students, something to look forward to. And we are also looking into the rules around gymnastics and being able to offer that as well. So that's where we are for the next season. And I just want to give that update as well.
Thanks. It's always nice to have some good news mixed in. Thank you guys so much again for joining us and for all of the information and your guidance as we, Oh, more questions for this? Okay, but we'll let them go. Thanks, Dr. Parkinson, and thanks, Scott, for being here. We appreciate it.
Thank you, guys.
Thank you.
Thank you.
Andrea, a question for Lori?
Well, a comment first, and then a question if I can formulate it. The comment is, I know that we can't discuss any of the cases, but I did just want to say that I hope everybody has a smooth, asymptomatic passage through that time period. And yeah, just thinking about all of our families and our students and our staff. The question around that I'm trying to formulate is around the sports, and there's two pieces going back and forth. One is that these sports now are moving indoors, and we're at a different time in community spread. So I'm trying to keep that in mind. But I'm also being very cognizant of what Dr. Parkinson said, is that when we're doing these things with the guidelines around them and it's just how we are in the schools, right? We're enforcing the rules, and that's helping keep everybody safe instead of the students going off and doing those same sports where someone might not be enforcing the rules. So I guess I'm just trying to figure out how we monitor that in terms of, and maybe the answer is the same way we do in the schools, right? But how that community spread could be creeping into something that's now being done in a little bit riskier community situation. Does that make sense?
Yeah, absolutely. We know that it's not zero risk, right? I mean, we know that there's not zero risk coming to school, but it is far less. The Cape Cod, healthcare, came out with, a statement this week that, right, there's 10 times as much spread from homes, from within homes than there is in community activities like schools, grocery shopping, or, such. There's that type of thing. So, and yes, is there a risk for sports? There is. And we thought long and hard about it. We talked about what the modifications are. And what we found in the fall, and I know they were outside, we're moving inside, but what we found in the fall was where students really followed the rules. They wanted to play. And that's what we're seeing in our schools, right? I mean, students and staff are, being really diligent about following what the rules are. And and we have to try, but we also know that we will watch the numbers in the community. And that's our plan now. We'll be very safe. And that's one of the reasons why no games till January is just to kind of, watch it but I do believe that we should be trying these things, that we should give opportunities. And we're not going to sing as we did in the fall. We did not start with spectators. We're not starting with spectators. I don't know if we will move to spectators at all because it is indoors. We want, this is about an opportunity for students. And I know parents would want to see them, and maybe we can get there and have opportunities, to come and watch. But I think the most important thing is for kids to get the opportunity to play. And I'm sorry, and also I didn't mention earlier, we still do not have any evidence that we've had any spread in the schools. We don't have that. So back to the point that Scott and Dr. Parkinson were talking about as well.
I think in this discussion about sports, you have to give a shout out to the coaches too, because when did a coach ever have to have a head thermometer in his? It used to be you just had the balls, right? But now they do that,
Yeah.
and I know it's stressful on the coaches too. I mean,
absolutely, they've asked for it, right?
Yeah.
I mean, it's not like I would never put a coach in a situation they weren't comfortable with either.
No, but I mean,
But
they rose up to it too.
Absolutely.
So, yeah.
Lisa? Yeah, I wanted to make a comment about the remote learning and hybrid, and how Dr. Parkinson said that, obviously the schools are clean, we're adhering to the guidelines, we're seeing very little activity as far as positive cases with students, the kids want to be here. Have you put any more thought into trying to pull more from the hybrid mode and bringing them into school, shortening the distance between the desks? I know that Desi was saying that 3 feet was the guideline, because the kids want to be here, and I know the teachers prefer to have the kids in-house. And we're showing now with updated data that keeps coming through, changes are coming through, they're learning more. What are the thoughts on getting more kids into the schools?
So right before Thanksgiving, we each school went through the process of identifying students. So teacher referrals, looking at attendance, looking at grades, and each school looked at the students that were either hybrid or remote, and determined would students be better if they were in school. And so we brought in another 125 students that started right after the break. So that was one step toward identifying those that we knew would benefit from being in. And that's really decided at the school level and at the teacher referral, because the teachers are with the students every day, and they know that. They know which students. There's a group of parents that is in support of trying to figure out how to get students in more days in grades 5 through 12. And I've met with them, Patrick and I met with them not long ago, and we talked through a lot of things. And we did decide that right now is not the time, that really into January would be the time to really start reevaluating things and thinking about, could we bring more students at that time? So thinking more, let's get through like these holidays and what's happening now. And, I certainly hope pulling back, to phase, to step 1 and phase 3, and, and people adhering, if people would listen to Scott and follow, what they're asking, is that going to be possible? And I certainly hope that, we always hope that the second part of, school, the second half of school, that we would be able to have those considerations. But I think the data's got to drive it.
Any other questions for?
I have a quick question. Laura, what's the name of the group you were just speaking of, in case there's any other parents that would like to join? Or
yeah, I think this is just a group that kind of formed together. I don't think they have a name. I think it was just a group of parents that are interested in getting back into person, and I don't know.
Are there Zoom meetings or an
Well,
email chain?
I only met with them once. Like, we met with them once. It was just a group that asked to talk with us to see what the plans were. You know, if we thought that we would ever come back, you know, into person. That always has to be, when we made the 3 models, right? It was always a consideration, right? And always a hope that sometime in the, you know, winter, spring, that would be a possibility. So. Okay. But anybody that wants to, I mean, anyone that has that can certainly email me, right? And I can make connections.
Perfect.
Okay. Yeah,
That works.
Okay.
I just have a personal comment. Because when I was imagining how I was going to juggle this as a working mother, having my kids in one week and then out one week, it just seemed really impossible to me. And I've got to say, my 2 kids who are doing it, they've been very successful. They love going to school, but it's also, I feel a little bit safer having them also with me remotely during the off weeks. And so I want to say thank you, because I didn't envision how that model could work. And now as a parent, I'm really seeing that it's working well for my kids. So I just want to acknowledge that.
Thank you.
So thank you.
It's nice to hear.
Any last questions? All right. Thank you. Thank you so much. I wish it was better news, but hopefully it will be in 2 weeks when we're meeting. Fingers crossed. Okay. So it's not Groundhog Day. I know that you probably feel like it is, because we had the same thing on the agenda 2 meetings ago, and now we're repeating ourselves again. So up next on the agenda is discuss and vote the determination of surplus property at the southwest corner of Mullen Hall School grounds and possibly transfer to the jurisdiction of the select board. So this, I don't remember what the date was, but we had it on our agenda to talk about the carousel property at the corner of Mullen Hall. We voted it, and then it was supposed to go to town meeting for a vote, but there were concerns about how it read on our posted agenda, and that might not have allowed the public enough access to participate in the meeting. So, you know, following open meeting law, we didn't want to just plow forward and instead put it back on the agenda. It's the same conversation and nothing has changed except for how we put it on the agenda. So I don't expect, you know, anything monumental, but we want to make sure that we're following the intent of the open meeting law and making sure the public has access. So we did talk about it at length, and I don't want to say, well, let's not talk about it at all now, because then that defeats the whole point of having open meeting law participation. But I think everyone really, in our conversation, everybody found, you know, their argument for where they sat on the topic. And so if we can, you know, if you have something to share, if you can just succinctly summarize what what your viewpoint was, and then we'll see if we have public comment, and we'll vote again, is the gist of it. And I have to read that incredibly long motion all over again. I know, sorry. So, John.
Well, Kelly, just a clarification first. So is that public comment of that individual's letter going to be?
Yeah, so Judy Fenwick was not able to make it tonight, but did send a letter for it to be read during our conversation. But I think in the past, we don't usually have to comment on our topics, but when we've done it before, pardon me?
We always ask.
Oh yeah, we do, but we usually do our part first, and then, so I was just thinking we would do our part first, and then we'll take public, any participants, and then our letter, but yeah.
So I can speak now, I just wanted to make sure that her.
Yes, we're definitely gonna read it, for sure.
Appreciate your indulgence, because it's not gonna be too quick, but I wanna touch on topics for everybody. And when I say indulgence, I mean to the whole board. I had mentioned some things the last time that I felt strongly about it, you know, being a potential distraction for the kids, and that they, you know, it had operated for years as, you know, what they had initially presented. The group, it's a you know, a separate entity, and they had said how they were going to operate it. In addition to those other items, and then how would it affect the sunlight and the breezes off of Shiverick's Pond in the hot summer days, you know, late June, early June rather, with schools continuing, and then in the September when it can be challenging. But in addition to that, So I just wanted to say those items. In addition to that, different things kind of came to light in the meantime, or you have a chance to think about things and other people that approach me with different topics. One thing that I think is very important to realize, this doesn't preclude the carousel from staying at Mullen Hall. You know, it's not a zero-sum thing of this is somehow an anti-carousel vote. You know, but it is a zero-sum situation of students years from now that might be able to use that land. You know, it's right on the main street there and right across from the library and on the waterfront. And I was very both heartened and disheartened to drive by on November 4th and see a group of children gathered around in a half a circle around a teacher doing outside teaching with an easel right at that spot where this building is going to be. And then there was another teacher with another set of kids that were running up and down. It was like something out of, you know, Little House on the Prairie when they're running down the grass or something. It was great. I was like, this is why I'm on the school committee. And then I was also thinking, geez, I'm so disappointed that we're giving that land away. That kids, not just these kids, but kids 20 years from now won't be able to run down the land like Laura Ingalls or something on that show. And then even more importantly, you know, kidding aside to references like that, you know, the teacher actually utilizing it, we're talking about all this outdoor space, and then we're giving land away to a third party. Now, also another thing a parent mentioned to me was, what about, you know, sight lines? So you have kids with you know, as we have issues with potential, you know, horrible situations that could happen, that we're doing different things if should a gunman come in or that into the area or something, to put a building that would obscure sight lines, where right now the teachers can say, you know, where's so-and-so as a student, both as a student kind of getting lost. And there's, with that said, there's a lot of areas in that park in general that have kind of sightline issues if anyone's brought their kids there, because it's so spread out. But to put the structure there is another safety aspect. And then, you know, then just some logistics from construction standpoint. Anytime you dig with a backhoe, that's a pretty significant incline there. Anytime you dig with a backhoe and dig stuff up and you have all the structure above, they're going to have to put some kind of you know, a retaining wall there. And I think that'll be important. Maybe that's something they're planning, I'm not sure. But I think that could impact any kind of slides, you know, landslides coming down, or then even just for them to protect their own building, they probably want to have some kind of diversion of the rainwater as it goes down, so it's not going right into the building. And then also that a stoplight in all likelihood would be needed there, because folks kind of go fast, and that's at the foot of the hill there. So I don't know whether that's other things that have been factored in. And I just have another couple of points. And then the issue with the value of the land, I know that's going to be discussed if they do decide, if it does go to the select board and then the town meeting does vote on it, then they would have to get, if it's above $35,000, posted in the paper for 2 weeks to see if some other party might want to bid on it also. But then just a clarification too as well. And my final point is that it was published locally, and it had been mentioned in the past too. And I think this is something that everybody will be on board with, this clarification. Then because somebody did ask me, well, how are you guys voting on that if you were on the committee? And we didn't, because it was published as saying that a school committee member were on the committee. And just a clarification, and I'm sure you'll agree with this, Kelly, too, as well. We didn't have anybody officially on the committee, correct?
Correct. We had a liaison to the committee, just to sit in and listen.
Right, and I think that's important because we're voting on it, and I think that's important to clarify. And I know the selectmen or the select board has at least one person that's mentioned that's on the committee, or they said they were on committee. I'm not sure if they were also in the same capacity, and it's being misquoted as well.
Yeah, I don't know.
But I would imagine if it did get to that point and they did that, I would hope that any individuals that were on a committee, you know, would recuse themselves from voting on that. But that's all my points. I just heartily request that everybody reconsider, anybody who didn't, to not give our land away that kids could use in the future. Thank you.
Thanks, John. Terry.
Well, as far as Kelly and I are liaisons on that, and it's more of just saving time. That's all it is bringing information back forth. Never giving an opinion. never gave
We just
any-
said it.
It's like we just had a budget meeting. We have members from the finance committee. It's just passing information back and forth. It's not being on that committee whatsoever, just to make that clear. Well, the thing about having land for kids, I think right now we're caught in this open space thing because of the COVID thing. That land is pretty far away from the building. Okay, it's pretty far away from the building. And I know right now, probably, like I said, we have this outdoor space use need, and that's playing in our thoughts about this land. The other thing that I said, reasons that I believe that we should do it is, it's an outdoor thing. It isn't like an indoor bowling alley. It's something outdoors for kids, all kids to do. And the nature of that pond in that area is planned on being altered a little bit. So it would fit, in my opinion, fit in with that different nature of the area around that pond. So those were my positive thoughts on doing it.
Yeah.
And it's a pretty structure, I think. I just think it's pretty, and it looks nice in downtown Falmouth.
Thanks, Terry. Leah?
So just having my children all go through Mullen Hall and just knowing what a community school Mullen Hall is. So for me, the carousel is also a community piece. So I look at it as just really being a good place for the carousel to be as bringing the community together. And I look at that playground over there as very much a community playground. So it seems to align with kind of what I see as the vision of the Mullen Hall School over there in our schools around being community-based. And so if this is going to support this aspect of our community, I am supportive.
Thank you. I know everybody had an opinion and I think everybody should voice it. So Andrea?
I know, I was thinking, okay, I'm just going to do it for the record because this might be the only time that this is looked at for this vote. And so, you know, my thoughts on this were really about setting precedent and essentially saying what type of criteria would we use as a school committee to make a decision, taking out who is asking for this. We are transferring land to the jurisdiction of the Board of Selectmen, the Select Board, to do something with it, right? And so it's not about whether or not I think that the carousel is the right fit. It's about how do we view what is under our jurisdiction, land under our jurisdiction. And I don't think that we can predict the future of how we might use that space. We're seeing many uses of it now, but I don't think that those uses will necessarily go away. Things may expand and we may wish we had it back. And I think that if it was something that was of educational or maybe even recreational value, then we could make a decision based on that. But essentially, I just don't think that we should be just voting to transfer land right now.
Would you like to go?
Natalie.
Yeah, so I was actually going to say exactly what Andrea said. So for me, it's not about the carousel. It's not about the value of the carousel. It's about setting a precedent. It's about the fact that we don't have a policy as a board or as a committee related to sharing land or leasing land to nonprofits in the area. And again, it's a beautiful structure, but what value does it bring to the educational process of the students at that school? I think that we need to sort of think of it in terms of policy and precedent.
Lisa, did you have anything you want to add?
No,
Everything's covered? Anything?
I do.
Okay.
So a few of my points have already been mentioned. First, we don't know the future. We don't know what we may or may not want the land for. I think that, yes, our outside space is happening right now, but I don't think that that's going to go away. I think that we're going to, as a society, continue to look at spending more time outdoors, not just when, you know, whatever this time that we're in is over or this phase passes. I think that saving our space is key. I'm also concerned with the land over there. I know I've said this before. John is right when you talk about using a backhoe over there. There's trees that have been there for many years. There's, you know, they would really have to think about a retaining wall. I don't know the structure, Terry, that you're talking about. That's beautiful. If you're talking about the carousel itself, it is gorgeous. There's no question.
It's beautiful.
But that's not the building that we're going to see most of the time.
Well, you're going to see the horses because people are going to use them every day.
Correct, but they're not going to be, the carousel isn't going to be open every day, you know, 365.
Well, and they were talking about in their structure having windows to close it off for the winter, which is.
They were talking about it, right?
Yeah,
I've yet to see that final plan, what that might look like. So I am also concerned with the precedent of what it would do for us in the future. We don't have a policy. We don't. This is such a challenging time in and of itself. And I just don't think that now is the time for us to be giving land away that belongs to our students, that belongs to our schools. I don't think this is the time. Or not just the time, I don't think we should be doing it for the precedents, for our students, for our future. Yes, it's a beautiful structure. Yes, the school is all about the community, but I just don't think it's a smart move.
Bill, you're the only one I hadn't checked in with. Would you like to add anything?
Yes, I would. I think education, our community schools are an enhancement to the community itself. I think everything we do enhances this community. I also think the Carousel of Light has been an enhancement to this community. And by moving it to a permanent structure would only make this community better. I'm voting for it.
All right, Leah, did you have something?
Can I say one more thing?
Yeah.
I was trying to figure out what it was that was a little bit more emotional for me about this. And I agree about the precedent and the policy piece for sure. And we've been through this before with the senior center piece. And I do think we need to look at that. But like I said, I am in support of this. And there is another reason for it. And as I was just hearing everyone talk, so I grew up going to Martha's Vineyard every summer, and I work on Martha's Vineyard, and I see how the flying horses over there are such an amazing piece of that community. And so I do see a carousel really having something that could really be community-based. And so I think personally for me, in seeing how that works with the community and what an attraction that is, I think that also speaks for why I'm going to vote for it. So thank you.
Thank you. And I think you got, John, do you have something
just
else?
one more thing, because it came up before about the flying horses, and the only distinction in that is that's not school land there that they put the flying horse. It's right downtown. I just felt I needed to say that. Thank you.
Yeah, so I do think that, I mean, we did an excellent job of very concisely recreating our exact conversation. I mean, I had jotted down a few things thinking, oh, maybe we'll miss this point on both sides, but I really think we covered everything that was said. So what I'd like to do is, does anyone have any public comment around this? If you do, you can just put your hand up by clicking on that little raise hand button if you're a member of the public and would like to weigh in. And while we're waiting for that, if you don't mind, I'm sorry to put you on the spot, but
no.
if you read the public comment that we received by email, and I'll make a note that, anyone is welcome to, if you can't make the meeting, send us an email and we're happy to read it.
Absolutely.
It just doesn't happen very often.
Okay, good. Okay, so this is public comment by Judy Fenwick. I appreciate the opportunity to present this statement for public comment on an agenda item before you this evening, which is to discuss and vote determination of surplus property of Mullen Hall School grounds and possible transfer of jurisdiction to the select board. Although I would have preferred to deliver this statement myself via Zoom, I'll be chairing the monthly meeting of the Falmouth Board of Library Trustees at the same time as your school committee meeting. So a member of your committee, Natalie, will stand in for me by reading this into the record. You will all have received a copy of the email prior to your meeting. I read in the Enterprise in late October that there had been a vote of the school committee on October 27th to dispose of Mullen Hall School property as surplus and turn over jurisdiction of that property to the select board. I watched the meeting as a rebroadcast since I was surprised that there hadn't been any notice including an agenda item that mentioned disposal of surplus property. After watching the rebroadcast, I checked the school committee agenda online for that date, which would have been posted several days before. The agenda posted several days before showed a topic of discuss and act on carousel of light request for use of space. I understand from your chair that the motion of the school committee voted on October 27th had been prepared by town council and presented to the full committee for the first time that day. The open meeting law has an expectation that the public deserves an opportunity to weigh in on topics that are posted on agendas. So you have an opportunity for a do-over on your original vote since the public didn't have the opportunity to weigh in on the topic that was actually discussed and voted. I ask you to consider some details around your responsibility as members of the school committee. You have a policy, ECA, Building and Grounds Security, that states, public school buildings and grounds are one of the greatest investments of the town. It is deemed in the best interest of Falmouth Public Schools and town to protect the investments adequately. And a policy, FCB, Retirement of Facilities, which discusses the possibility of closing schools. The statement appears, the school committee may seek both professional and community advice in making its recommendations regarding the future of the facility. This will permit the public, which originally acquired the property, to benefit from its recycling or retirement. I ask you as a committee to take a long view in voting disposal of surplus property. Has the school committee talked in the past year pre-pandemic about declining enrollment and the long-term or short-term need for 4 elementary schools? Add to that the 10% drop in the birth rate being projected for the next few years because of the pandemic, and the flight from public schools by those with the means to afford private and those who want to homeschool. When I first served on the school committee in 2001, our enrollment was just around 5,000. Today, your enrollment hovers just under 3,000 students. Mullen Hall will always be the flagship elementary school, and every foot of property will become into play in the next 10+ years. Will you need to enlarge the building to accommodate more students as elementary schools compress? Enlarge the playground, enlarge the garden, expand outside teaching space? Will space for trailers be needed? The vote you may take tonight is a vote to give up land. I hope you have carefully studied your options as a group and have answered all of the questions you may have before you make a commitment to dispose of property. Remember, it is deemed in the best interest of the Falmouth Public Schools and town to protect the investment and property wisely. And again, that was Judy Fenwick.
Thank you. Thanks for reading that. I could have saved myself my whole summary if I had just read her letter. Okay. Do we have any hands up? Okay, thanks. Okay, so I'm going to make the motion, and I apologize in advance because, as you remember, it's super, super long. So I move the school committee declare the following part of the Mullen Hall School property to be not needed for school purposes. Land of the town of Falmouth shown as proposed lease area, 8,100 square feet plus or minus on a plan entitled Site Plan for number 140 Catherine Lee Bates Road, prepared for Carousel of Life Inc. in Falmouth, Mass, dated October 26, 2020. Prepared by Falmouth Engineering, Inc., said proposed lease area containing 8,100 square feet plus or minus and being more particularly bounded and described as follows. Beginning at a point in the northerly sideline of Catherine Lee Bates Road, a public way, said point being 25 plus or minus feet south, 76 degrees, 10 minutes, 48 seconds east from the southernmost point of the abandoned portion of Hamlin Avenue shown on the plan entitled Town of Falmouth Abandonment and Relocation of a Portion of Hamlin Avenue, dated November 2001, last revised 9/30 of 2002, which plan is recorded in Barnstable County Registry of Deeds at Plan Book 578, page 3. Thence, north 10 degrees, 50 minutes, 47 seconds east, 68.96 feet, thence north 14 degrees, 16 minutes, 30 seconds west, 41 feet, thence north 76 degrees, 8 minutes, 20 seconds west, 74.7 feet, thence south 16 degrees, 10 minutes, 33 seconds west, 36.17 feet, thence south 13 degrees, 46 minutes, 5 seconds west, 13.84 feet, thence south 0 degrees, 42 minutes, 57 seconds west, 3.37 feet, thence south 75 degrees, 44 minutes, 38 seconds east, 12.98 feet, thence south 27 degrees, 46 minutes, 28 seconds east, 38.36 feet, thence south 13 degrees, 49 minutes, 12 seconds west, 23.04 feet, and thence south 76 degrees, 10 minutes, 48 seconds east, by the sideline of Catherine Lee Bates Road, 59.85 feet to the point of beginning. Whew. And subject to town meeting approval, said property may be transferred to the select board for municipal purposes, subject to the following conditions. Said property shall be used for recreational purposes only. Said property shall not be used during the hours the Mullen Hall School is in session. Any structure on said property shall be located in such place to persevere and maintain views of Sugar's Pond. Any structure on said property shall be located in such a place to preserve existing trees. There shall be no alcoholic beverages or smoking permitted on said property. No structure shall be erected on said property until the Mullen Hall School is able to open for class instruction without any COVID-19 restrictions. Any lease of said property shall require a removal or decommissioning bond to remove any structure and restore said property at lease end. Any use shall include an appropriate fence, and said property shall revert to the jurisdiction of the school committee if any use is abandoned or not used for a period of 2 years or more. Is there a second? I just wanted to make sure. Second from Leah. And we'll take any last comments. And I'll just make note that this motion was prepared by council, as was the agenda item this time around. And it's a roll call vote. Bill, we'll start with you at home.
Yes.
Leah.
Leah Palmer, yes.
Andrea.
Andrea Thorold, no.
Terry.
Terry Medeiros, yes.
Melissa.
Melissa Keith, no.
Natalie.
Natalie Canalopoulos, no.
Lisa.
Lisa Hart, yes.
John.
John Fenari, no.
And I am again a yes. It's exactly the same, so the motion carries 5-4. And then the next step in the process is for it to go to town meeting, where a vote of 2/3 of town meeting is required to actually move it to the next step. It's on the warrant for being at the January town meeting, although I think the intention was to indefinitely postpone it last time, so who knows, where will we at? All right, moving on. Oh my goodness, we're so far behind. Okay, preliminary budget 2022. Are you leading? Is Patrick leading?
Patrick is leading us.
Great, Patrick, where are you?
I'm right here.
Oh, there you go. When you talk, you become big in the room. So lead away. Tell us about our preliminary budget for 2022.
Yeah, so we're very early in the budget season, obviously. The principals have responded with their supplies and materials budget. We did a nice job with that. I just wanted to share a couple of things, kind of the assumptions and realities that we are using to build the fiscal year 22 budget. The first assumption or reality is the guidance that was given to the select board by the Jennifer Mullen, the town CFO, back in September. And that guidance was that she was recommending that all departments be allocated a 1.5% increase over their fiscal year 21 budget. Now, the superintendent and I did have a conversation with her about that, and what she reiterated was that was her guidance at this time. I do have to give Jennifer Mullen a lot of credit. This is an extraordinarily hard time to make sort of guesstimates and decisions about a budget that will take us through June of 2022. And the guidance, there has been no guidance from the state, right? We're not even, the state hasn't even completed a fiscal year 21 budget. That I think it's very close, let alone really gotten going on a fiscal year 22 budget. So she was very aware of the impact of a 1.5% increase on the school budget would have, and that goes into a couple of other assumptions and realities. That we are entering the third year of our collective bargaining agreement. By definition, third years tend to be the most expensive years of any collective bargaining agreement. It will be for us too. So even in normal years, it would be an expensive year for us. We're going to go into the fiscal year 22 budget process trying to view next September as close to normal a school year as possible. We don't think it's going to look like this year, but it may not look like an entirely normal year. But the local budget we can move forward with producing the local budget and making the same types of decisions and having the same types of discussions as we've had in previous years. Because that's what we know now about what we can move forward on. And the discussions about class size, the discussions about enrollment, the discussions about filling retirements and resignations, those are things that the administration does all the time. And we need to continue having those discussions over the next 6-7 months. So what 1.5% means is about $753,000 more. That sounds like a lot of money. It is a lot of money. However, even in the best of years, a 2.5% increase is kind of what the school district needs to cover its costs. And on the third year of a contract, it usually can inch up from there. And that's closer to $1.25 million. So there's just starting off, we know there's approximately a $500,000 gap or so. So we did have this conversation already with the CFO, Jennifer, and she did recommend that we consider tapping the town's sped stabilization fund for fiscal year 22. Now, when we say tapping that, what we're really talking about is that would be a contribution, a one-time or nearly one-time contribution to the fiscal year 22 on top of the 1.5% allocation. So it wouldn't necessarily be added to in following years. And what we don't want to do is drain that whole account. So I asked the town to check on what that number was. It was approximately $950,000. So we might be considering adding or asking for another $475,000 or more to support the 1.5%, in addition to the 1.5% allocation. Now things can change over the next few months. You know, guidance from the state has been, you know, generally positive in terms of revenue estimates. Revenue numbers haven't fallen off the cliff. There may be another round of economic stimulus or stabilization or support from the federal government. So there's a lot to learn, but we need to keep moving forward with the fiscal year 22 budget process. We are moving forward with it. And I just wanted to share kind of the assumptions and the realities that we're dealing with right now. You know, the discussion about what if we do need all the temporary employees that we have right now next year? Well, we don't have an answer to that right now, and no district has an answer to that right now. So we're just going to have to work on the pieces of the puzzle that we know how to put together right now. There may be other pieces of the puzzle that will sort of help us figure it all out in the spring and the summer. But we're gonna do the bulk of the work right now and follow the timeline that we're used to, and keep moving the district forward.
Thanks, Patrick. Leah was quick. She's got a question. Like, she's been holding it.
Yeah. I have two questions actually. So, Patrick, my first one is, what percentage would just the contractual increases be?
So yeah, that's a good question. They're going to eat up 2.5% in and of themselves.
So we're looking at, this is not level. This is actually cutting that what we have to do.
Well, no, what we're saying is that if we tap the SPED stabilization fund, that gets us to that 2.5%.
Okay, so then my next question is around that SPED stabilization fund. Yeah. What are the parameters with how we can use that funding, since it is a special education out of district? It was really for out of district placement. Right.
Well, you know, that's a good question, and we did ask Jennifer Mullen that question, sort of, you know, what are the limits on that? How was that written? And she was the one who brought it up, that it can be used to support the district, stabilize the district. So the way it's a local thing. It is not a state fund or anything like that. So that it was an idea, a suggestion that she brought up, and that it was a good time for the district to consider leveraging that.
Just a follow-up question to that. What are the steps for that? And with that would have to be approved at town meeting, right? And there might be some pushback that we wouldn't be using it for what it was intended for.
There might be. My understanding is that we would just present our budget the way we want to present it, at the amount we want to present it, and the recommendation might be to the town that we'd like to have the allocation, and we'd like to get their support to tap that stabilization fund, or a portion of that stabilization fund.
So that was my question as well. I didn't even think of it when we had budget subcommittee, but the warrant articles, if this requires a separate article for the spring town meeting, then that's due, I think, like the first week in, or second week in January, and we only have one meeting between now and then. So whether or not we can, I guess, just get clear guidance for how that,
what the language is.
When that was created, when that stabilization fund was created, whether or not there are really strict parameters. I would guess that if we say we're spending that part on special ed and then the rest of the budget is spent out of the capital, it might not matter a whole lot. And I think that the town is probably pretty understanding of the predicament that we're in right now.
Yeah, I mean,
but
from an accounting,
we should, I mean, we still have to go through the steps and it still has to be voted on at town meeting. So.
And confirming the language that's required is definitely a step. And from an accounting perspective, what I would be doing is just showing a reduction in one line item to balance the budget across the board, right? And it would be made up by some level of contribution from that sped stabilization fund. Now, this is a strategy, right? If working with the town CFO, she, and we get more and different guidance from the state, the other strategies come into play. We'll consider those.
Andrew, did you have something?
Yeah, Patrick, you were saying about the Special Education Stabilization Fund that obviously we don't want to deplete that and it has a purpose. Can you explain how that would get repopulated with funds?
That takes a history lesson because that goes back probably 7 or 8 years. I think the town voted to fund it in at about a couple $100,000. I think it was $250,000 to $300,000 a year for 3 years, and then the extra has been some interest earned. So it was kind of, I think that was before my time. Actually,
I remember it. We voted it. We created it when we thought that we were going to have a shortfall in the district because of special ed, like boom, for out of district. It was put on the warrant to create that fund and fund it all at the same time, and then it's been increasing in its funding so that we wouldn't end up in a year where we had this sudden and dramatic shortfall. Really not our own doing, it's something that you just can't predict. And so I think it's funded, with free cash. It was funded with free cash, I think, the first time. But I think since then it may have been part of the budget to fill that stabilization fund along with a lot of other stabilization funds.
I was wondering if it was like the other stabilization funds. So, but basically, to get that money back in there, we would have to go through the same process. It's not something that's an ongoing top up. We have to.
I don't know if it's
the town did it. I think the town through FinCom did it. They fund the various stabilization funds because it's a benefit to the town from when they do bond reviews and things like that. It's it makes the town look good financially, which lowers their bond costs and things like that. So there's benefits to this. The other thing that I want to compliment, all our student services and our out of district placement folks. We've been continue to do a nice job managing our out of district placements, and again, as of December 2020. We're looking out, for the next 6 months and the next year, and we do not see any additional new spikes in out of district placements. So, there does not look like there would be a need to tap this again rapidly the next year or something like that.
And either way, you're not talking about emptying it, right?
Correct.
Still be some, even if it's not continuing, at least there'll still be money in it.
But and the reason why we would not want to empty it is, literally a year ago, we were thinking that we might need to tap it this year for some increases to the total. We were thinking about a couple $100,000 we would have need to request it. We were able to avoid that because we were able to fully fund our circuit breaker at the end of last year. And that was just through sheer luck of having some surpluses based upon our not having to cover all our transportation costs. So that bought us this opportunity, right?
Any other budget questions for Patrick? All right. Thanks for keeping us on track. Hopefully, hopefully our regular process will get us through. That's the hope, right?
That's the goal. Thank you.
Thanks, Patrick.
Thanks, Patrick. Okay. Next, we have an update on the job description for the diversity, equity, and inclusion coordinator position. I thought I saw Johnny pop in. She here? Great.
I'm here.
Johnny. Hi.
Hello, everyone.
What can you tell us? Where are we at?
We're in good shape. The draft job description for the diversity, equity, and inclusion coordinator position for the town was posted on both the town and school district's website through November 27th for a combined total of 52 days instead of the 30 days we had initially planned. The additional time provided individuals the opportunity to offer a robust total of 50 pages of feedback, recommendations, and comments. The Equity and Diversity and Inclusion Coordinator position is a position whose time was overdue in being reinstated, and all the feedback collected applauded the direction of the town in doing so, and I thought it was important for you to know that piece. We appreciate the public input, which was hearty, it was thoughtful, and it was insightful. We're going to continue to analyze themes across and among all the written feedback that was provided, and then edits will be incorporated in the current draft based on that analysis. The town's Affirmative Action Committee has received the same packet of public input and is also analyzing it for recommendations. Once we're completed in that process, it'll be presented to the Board of Selectmen and the school committee for approval as required. We tentatively expect to present it in early January 2021 in a possible joint meeting. As we continue with the process, we are mindful that there's a timeline and that's essential, but we won't rush or skip key steps to continue to operate from a place of transparency and inclusivity, which is our goal and our focus. We will be working simultaneously on creating a comprehensive list of outreach efforts to recruit diverse candidates so we don't fall behind in that process. So that piece is really important, and we're really thankful. I've read through all of the comments, and people were willing to provide input that will strengthen the job description, and in many instances, they provided resources on recruitment and subsequent goal setting for the position and training. So folks were very thoughtful and insightful and generous with their feedback.
Thank you. Natalie, I think you're sitting on that committee as well. Did you want to add anything, or did you want to cover everything?
I think she covered everything that needs to be covered. I know that the representatives from the Affirmative Action Committee are appreciative of being involved in the process. But Joanie and Denise from the town have been amazing and have absolutely just sort of taken this and harnessed it. And I applaud all of your efforts. So thank you.
Yeah, thank you so much, especially on top of all the other tons of hiring that has had to happen. That you've been able to give this so much attention. I really appreciate it.
Absolutely, it's good hard work.
Any questions on it? Leah?
I just have a clarification question. So the next step would be that everyone comes together and looks at the feedback.
Yes. So we're current.
Go ahead.
That is correct.
And then revising the job description based on the feedback.
Yes.
And then a presentation to the Board of Selectmen and school committee.
Yes, the final draft will be presented after vote on approving the job description.
Okay, thank you.
Because it's sort of a new position, even though it's bringing back an old position, it has like a new take on it, right? That shared position between the town, but the job description will be new.
Yeah,
so
it just sounds like there's like multiple steps. So as much as we can help kind of streamline that, so we can be with the Board of Selectmen, or
yeah, that might help
to not have to have everyone present lots of times the same information.
Right, that's fair. Yeah, that's a good point. And we do like to have a joint meeting with them every once in a while anyway. So maybe that would be a good reason. Any other questions about the job description? Awesome. Thanks so much. Thank you.
Thank you.
Take care. Presentation on student safety and discipline report.
We have some very good news for you.
All right, we like good news. Joan, you get to share good news?
I do. So yes, thank you. I did want to share out the findings from the analysis of the student safety and discipline report in regards to, it's coupled with our SIMS data, and it's in regards to significant disproportionality in special education. So as you know, the Department of Elementary and Secondary Education and all of the districts across the Commonwealth have made it the priority to increase educational access and equity for our most marginalized students, especially students with disabilities. So with these priorities stated, they necessitate the Department of Education, which is pursuant to the requirements that fall under the Individuals with Disability Education Act, the IDEA, and that is to identify any significant disproportionality in special education and analyze district data on an annual basis. And then they're obligated to report that data to the Office of Special Education Programs if they're finding any significant, any of the findings of significant disproportionality in special education of racial and ethnic groups. So I am happy to report that DESE has reviewed our student information SIMS data, so the SIMS data, coupled with the student safety and discipline reports from our district. And what they do is they look at the data from the previous 3 school years. And so this year, again, we were found that we were not identified as having any significant disproportionality by race or ethnicity in our special education. And they look at our special education identification, our placement, or our discipline. And that's for the school year, the 2020-2021 school year. So as I mentioned, the disproportionality data is analyzed by race and ethnicity of the students, and the special education identification, placement, and discipline. And those data points are defined as the following, and it's how the Department of Education, DESE, defines them. So under race and ethnicity, our classifications are African American, Asian, Hispanic or Latino, multiracial, Native American, Native Hawaiian, and white. And then when we look at our identification, so they're looking for any kind of significant disproportionality in how we identify individuals with special needs. So under our eligibility categories, they look kind of collectively at all disabilities. So it's eligible for special education and related services, or under the categories of intellectual disability, communication disability, emotional disability, health impairments, autism, or specific learning disability. Then they look at our data as it regards to placements for students with special needs, and they look specifically at our data of how we place our students that are in any substantially separate placements or in any separate schools, so an out-of-district placement. And then they look at our discipline data. And they look at the data as all disciplinary removal. So they look at that as a chunked discipline. And then they look more specifically at out of school suspensions and expulsions of 10 days or fewer, out of school suspensions and expulsions of more than 10 days, in school suspension of 10 days or fewer, in school suspensions of more than 10 days. So across all of those, they look at all of our race and ethnic subgroups, and then they look at our special education population across placement, identification, placement, and discipline. So we were not found any significant disproportionality across our group. So I can at least report out for the past 3 years. So I'm very happy to report that. And I also just wanted to comment that it's just important to note that our data for this year was not impacted by the pandemic because they're actually using the SIMS data from the October report of 2019. So I'm very happy to report that for the 3rd year, the Department of Education has found Falmouth to not be in any significant disproportionality by race or ethnicity in special education.
That's great.
Yes, yes it is.
Thank you for sharing. Any questions about or comments about our meeting? Andrea.
Just a question to clarify. So this is in special education. Do we do the same type of analysis for the district as a whole?
I don't know if Joe can.
Did you hear the question? Whether or not, so this is just for special education, disproportionality, but do we, internally or externally do that same type of analysis?
Yes, internally we do look at that as we meet with our administrative council and well as our district instructional leadership team. We do look at our data as we drill into, like we do with our state assessments, all of the data across that. We do look at any disproportionality when it comes to our subgroups, both our, whether it's special education, our high needs, our discipline across any of our race and ethnicity. So as we look at the subgroups defined by DESE. So yes, we do look at that. We report out the discipline data on a monthly basis as well. So each school gets their discipline data, and then collectively at the central office, we look at that. So to answer that question, yes, we do. This specifically under what I just reported out is an actual analysis that's required through the Department of Education. It's required of the Department of Education through the governing laws under the Individuals with Disability Education Act. It's always been present, but back in around, I believe 2016, they were noticing that there were many districts that were still perhaps not addressing it as needed. So what they did do is they tied federal funding to districts that are found to be, to have areas of significant disproportionality. And then under their, Part B funds, they do mandate districts to allocate some of those resources to ensure that they're addressing any of their disproportionality. So hopefully that answered your question. And if not,
no, that was great.
Thank you so much. That's helpful.
Leah, I guess to kind of piggyback on that piece, looking at kind of the opposite spectrums of, not necessarily the discipline piece, but looking at our students who are represented in our AP classes and in our teen program. I don't know if the teen program still exists, but do we have, I think maybe that's kind of what you're talking about, but looking at, okay. But
that would be a second separate,
yeah, so
do we do that?
It's just, yeah, so looking at, I know that's really kind of drilling down to the depth of what we have in our system, but I would be very curious to look at some of our more accelerated programs and seeing, if there is disproportion there and what we could possibly do about that.
Yeah, because I think the news is incredible, and I'm also not surprised, because if we're looking at this data every month, then if there are any internal issues, they've been long since remedied, I would hope, before the big report comes out. So the same could be true of access to our honors and AP classes or whatever special, other programs there are. If we see discrepancies there, then we have the opportunity to fix them as well.
Yes, each district is responsible for submitting all their discipline data. So, so what I spoke to again today is more specific to under special education and that formal analysis that happens, data review that happens on an annual basis. But to your point, Kelly, we do look at that internally internally. And I don't know if Sonia, if you want to speak to anything more of the data reporting for.
I mean, you come to share good news and then we're already on to like, how can we do it even better? You know, it's terrible, but that's how you get better, is to always be looking for the ways.
And I think that aligns with our goals.
And it aligns with our goals.
That, you know, just being cognizant that we're looking at disproportions everywhere, not just in one area, right? Yeah, for sure.
Mm-hmm.
Yeah. Well, I know we've had reports on scholarship in our district tied into sports, and historically Falmouth athletes, there's a lot of, what do you call them? Athletic scholars. There's a name for it. I don't know, but we have a good percentage of that historically. So, I mean, I remember hearing that report over the years.
Yeah, scholarship is another great thing that we can.
Student athletes.
Student athletes. Yeah.
Student athletes.
Because student comes first and athlete comes second.
Yeah.
Any other last questions or comments for Joan?
Yeah, I do.
Oh, hey, Bill.
Yeah, Joan, question. You mentioned additional funding.
Mm-hmm.
Am I correct on that? So the additional funding, is that then tied into the IDEA, or is IDEA and the separate funding separate? Because we have IDEA funding from the feds.
Right.
And obviously we're getting more money based on the success of the program.
So just to clarify, Bill, we don't get more money when we're successful. If we're found to have any significant disproportionality, they then mandate the allocated money that we do get, and they mandate a percentage of that money be specifically addressed or allocated to address your disproportionality within your district.
Gotcha. No additional dollars.
We don't get any additional funds.
Yeah, I was trying to help Patrick Murphy out.
I appreciate it, Bill. I appreciate it. But no, we don't receive any additional funds.
Typical of federal.
Thanks. Thanks so much, Joan.
You're welcome.
Take care.
Thank you.
So that was a pretty good segue into our school committee goals. So back in August, we started talking about our goals as a school committee, and then we met again in a retreat last week to work on them. I don't know if I have permission to share.
All right.
And we are just gonna, hopefully everybody had a chance to look at them. The school committee had a chance to look at them prior to today, and just make sure that they accurately reflect our conversation. But Leah, do you think, I think we should share our goals out loud for the public. I don't know if the measures of success are as interesting to everybody, but I don't know how you wanna, however you wanna lead the way.
Okay, well, yes, thank you. So I think just to get a little background around where our goals came from. Our goals really are based on what Lori's work and what her goals are towards really supporting our school system. And so we looked at those, the goals that the superintendent has for this year, and kind of said, well, what are some things that we then can support both Lori and the community in? And so we narrowed that down to two areas. The first area is the COVID-19 communication, and that is our first goal. And that actually aligned to some of the questions that came with looking at our numbers and how we can do more outreach and support for our community to ensure that we can keep our schools open and safe and help stop community spread. So I don't know if I need to read this. Should I read it?
Why don't we just read the goals and not
just read the goals.
Yeah.
So our goal number one, Falmouth School Committee will support the superintendent in efforts to keep schools safe, open, and students engaged during in-person or remote learning as appropriate. Falmouth School Committee will support the Falmouth Public Schools communication around COVID-19 with openness and transparency, including presentations and information sharing with community experts. And in doing this, I do think the key actions are important to note, just that we invite community members who are health and safety experts to present at our school committee meetings. This has been demonstrated by Scott McGann being here and Dr. Parkinson, and then identifying and outreaching to key groups within the community that we can build partnerships with and share resources and really support the end of community spread. And then there's the measures of success.
Great. And then our goal number 2. You can see.
So, and I guess, again, so our goal number 2 aligns to looking at kind of these disproportions that might exist within our school system that might be due to some systemic racism, and ensuring that we have equity, access, inclusion, and diversity. So our goal number 2 is Falmouth School Committee will build a foundation of knowledge and understanding around equity, access, inclusion, diversity, and systemic racism. And so basically what our goals or what our key actions are for this year are really to start building our foundation as a school committee to understanding the understanding more around equity, access, inclusion, diversity, and systemic racism. And that's
great.
Pretty much it.
I think it's important that the public know what our goals are.
And I just think the process worked really well last.
Yeah, the process was great. So thank you so much for leading us through that. I thought you did a wonderful job of taking all of our comments and making it into something that made sense. So thank you for that. Did anybody have anything that they wanted to edit or add or comment on around our goals? Oh. Thanks. All right, great. Thanks. Moving on. Act on a $1,500 donation from the George Lusk Trust. So this was a donation for art materials for in-person and online students in Ms. Baker's studio art class. So generous.
Very nice. Very generous.
Very thoughtful. So sweet. We need to know anything else about it?
I motion that we accept the aforementioned donation.
Thanks, John. And is there a second?
I'll second.
Thanks, Melissa. Any last comments? Other than our wonderful appreciation.
Thank you very, very much.
Great. Because we are not 100% in person, it's a roll call vote. Leah?
Leah Palmer, yes.
Andrea?
Andrea Thorold, yes.
Terry?
Terry Medeiros, yes.
Melissa?
Melissa Keith, yes.
Natalie?
Natalie Canales, yes.
Lisa?
Lisa Hart, yes.
John?
John Fenari, yes.
And Bill?
Yes.
And Kelly Welch also yes. It's unanimous. Thank you so much. Conduct our routine business. So is there a motion to approve the minutes from the November 16th, 2020 meeting? Motion to approve the minutes. Andrea, and is there a second?
Second.
Natalie, thank you. Any comments or edits?
I did have a comment. Sorry, I'm gonna have to.
No, it's fine.
If I can find that. I know I did this the wrong way. Oh. No, it just was it was the past or the present tense that we're using. And so it was just kind of, it went back and forth there of they are located and then all other participants were remote. So I just wasn't sure. That was just, I guess it didn't actually have to be an edit. I just was confused about our verb tense. Do we say it in the present or do we say it in the past with our?
Oh, yeah, I don't know. I didn't even catch it.
We're getting into time travel.
Yeah.
I just, you know, is it minutes of right that moment?
I'm just kidding.
I don't know.
Typically, you would have it the same tense, I think, but in that case, because they are present, but then the other ones were.
Everything else, yeah.
I think it works.
I think everything else is past to be heard. So I think everything else is past.
So maybe it would just be in the past that the members of the school committee were located.
Yep.
Yeah.
Okay. So
yeah,
one edit to read: members of the school committee were located at Falmouth High School Library. Great. We have a motion and a second to approve with one edit of the word were instead of are, and it's a roll call. Leah?
Leah Palmer, yes.
Andrea?
Andrea Thorold, yes.
Terry?
Terry Medeiros, yes.
Melissa?
Melissa Keith, yes.
Natalie?
Natalie Canopoulos, yes.
Lisa?
Lisa Hart, yes.
John?
John Fenari, yes.
Bill?
Yes.
And Kelly Welch also, yes, the unanimous. Thanks so much. Report from the chair and committee member reports. Just a quick update that we are still very regularly meeting with the FEA team to discuss our COVID MOA. We're meeting at least generally around once, sometimes twice a week, and still working forward on that. A quick apology that I think at our last meeting, someone requested that we get back to having the student advisory rep with us, and I spaced and forgot. So I will put that back on the list and try and get it done for our next meeting. Did anyone have any other committee member updates or reports now?
Just very quickly, the evaluation subcommittee met last week. You all received an email, but just one more time that if you could look for either opportunities from YouTube or Lori can share some observation opportunities for her evaluation, her mid-cycle. And then all evaluation observations are due to Lisa by January 7th. So just circling back on the email that you received last week. Thank you.
Other handle people.
Yeah, probably more of a, sorry.
No, it's
probably more of a future agenda item rather than the committee report. I just, in a comment that, you know, you thank the administration, the teachers, the support staff, and the bus drivers, because that can't be easy, the bus trips with this current dynamic that we have going on. But I want to applaud, I'm going to actually applaud the students and the parents for making this work and for their efforts of making it work on a daily basis of saying, we've got this, what's next? And on that note, I'd like to suggest something that if we could set up like a best practice video or any other methodology that we could get folks, you know, the students and the parents, if they're willing to share amongst themselves. But I think the students, if we did a video of, you know, here's a best practices, here's how I do, here's how I deal with hybrid, here's how I deal with whatever. And just, we've done it before in the past, like with the T-ticket school several years back, and then different things where the individual, East Falmouth did a great video where the kids, and you engage the kids, you're having them say, I do this, whatever, and you can have it, you know, like a segue from student to student, or maybe highlight an individual student, but then share internally amongst the school. So in addition to sharing information, it's also more of like, we're all in this together and create a bonding thing. Because, you know, I'm proud of that. I'm very fortunate to have a network of folks that I interact with. I'm amazed at how casually the students have been like, okay, this is what it is. And then they just move forward to whatever the next thing is. And I think to highlight that for the ones that maybe aren't saying this is what it is, it would be very helpful.
Thanks.
You're welcome.
Any other committee reports, requests? Is there a motion to adjourn?
I make a motion to adjourn.
Thank you, Melissa. Second?
Second.
Natalie's got the second. Leah?
Leah Palmer, yes.
Andrea?
Andrea Phillips, yes.
Terry?
Jeremy Jarrett, yes.
Melissa?
Melissa Keith, yes.
Natalie?
Natalie Canopoulos, yes.
Lisa?
Lisa Hart, yes.
John?
John Fenari, yes.
Bill?
Yes.
And I'm also a yes. We're
Thank
adjourned.
you.
Thanks so much. It's nice meeting in person.